image-guided breast biopsy using functional imaging and ultrasound. So breast cancer, as we may know, is the most commonly diagnosed non-skin cancer in women. In Canada, it is estimated that approximately 27,400 women will be newly diagnosed in 2020. As a lifetime risk, this represents 1 out of 8 Canadian women. Most breast cancers are typically detected by screening mammography, and this involves the use of low-dose X-rays to image the breast, as shown here. However, the sensitivity or the ability to detect breast cancer is dependent on breast density. So what does this mean? Well, typically our breast is composed of fatty tissues, glandular tissues, and fibrotic tissues, which appear white on a mammogram. And an increase in these tissues can increase the image brightness and decrease the contrast, and breast cancer can be missed. So this high breast density accounts for approximately 40 to 50% of Canadian women. Diagnostic imaging using ultrasound and MRI have been used to find these breast cancers that are unable to be seen on mammograms. Unfortunately, ultrasound and MRI can show more findings that are not cancer, and this can lead to unnecessary testing, biopsy procedures, and as you can imagine, increased patient stress. So these breast imaging methods are inherently anatomical, which means they image breast structure and tissue density. So an alternative uses functional breast imaging, which relies on changes of activity in these tissues. And this allows us to detect regions of increased glucose uptake and activity, which is a hallmark of cancer growth. So as we can see with these equivalent images, this removes the dependence on breast tissue density. So how exactly does functional imaging work? Well, functional imaging combines a molecule such as glucose and a radioactive tracer, which tracks the molecule's position in the body. Then by using a special camera and breast-specific detector plates, we can detect differences in tissue activity and therefore find breast cancer. So positron emission mammography, or PEM, is an alternative breast-specific functional imaging method proven useful for detecting breast cancer. And this technology has been shown to better detect small breast cancers. And another clinical advantage is that it can reduce breast compression, which may alleviate patient pain during imaging. So to diagnose breast cancer after it's detected, an image-guided biopsy is typically performed, and PEM shows this promise to better detect breast cancers independent of breast density. But since it removes anatomy, it limits the ability to see the needle and the tumor to perform biopsy. Essentially, you can't target what you can't see. So my research focuses on addressing this challenge to guide biopsy by combining PEM with the ultrasound-guided expertise in my lab. And ultrasound will integrate anatomy and allow for needle visualization during biopsy. So we designed a new image-guided biopsy system, which was designed to operate with an advanced PEM imaging system in between its 2 breast imaging detector plates. And here's an image of our system, which integrates an ultrasound probe and a needle biopsy device. And to guide our components, and particularly our needle, to biopsy breast cancer detected with PEM, our system contains an arm to track its 3D position in space. And testing the system is really important prior to clinical implementation. So how do we test the accuracy of our system? And really, this is the focus of my current work. So we performed breast phantom experiments to simulate breast imaging with embedded breast tumors. Then with custom 3D guidance software, we tested the positioning of our needle using our system. And here we found that our system's positioning error was less than 1 millimeter relative to this PEM image space. So then when positioned, we can use our ultrasound to guide our needle and compare it to our target position. And in these studies, we found that our needle targeting error was less than 2 millimeters. So overall, we showed a highly accurate positioning and targeting system. So in summary, PEM provides this potential for better detection of small breast cancer. Then integrating ultrasound will improve the visualization and the needle targeting for biopsy. And ultimately, this high accuracy of our system can allow us to sample small breast cancer, allowing for early stage diagnosis, better treatment decisions, and ultimately towards better patient outcomes. So finally, I'd like to just acknowledge my lab, collaborators, and funding sources, and give a special shout out to CCS and London Riot. And thank you for your time and attention.